Hey everyone, hope you're doing well. I wanted to come on here and talk about gut health. I have 5 minutes before my next meeting, by the way, so I'm going to talk really fast. But one of the biggest things I find when it comes to gut health is really figuring out what are the symptoms. If it's bloating, gas, is it constipation, diarrhea, or looser stools. Really figuring out what the actual digestive issue is and then treating that. So when we're looking at digestion on a whole, we know that women with PCOS have something called dysbiosis, or lower levels, can have dysbiosis, but lower levels of good bacteria in their gut. So it's taking a good probiotic, eating probiotic rich foods. I know a lot of people don't eat dairy products when they have PCOS, so yogurt might not be the best option, but things like coconut kefir, things that are fermented like sauerkraut, kimchi, kombucha, all of these things can be really helpful in terms of getting those good bacteria into the gut. When I was first diagnosed with PCOS, one of the biggest things for me was candida. So this is an overgrowth of yeast in the gut, and I found that it caused a lot of symptoms like bloating, fatigue, chronic yeast infections, and so working on pushing that candida out of the gut was really helpful for me. And how I did that was by lowering the amount of sugar that I was eating to help kind of starve the yeast that was there, since it really likes to feed off of sugar. So candida is another one to consider, especially in the gut. And then and it does actually really happen in women with PCOS because of the insulin resistance. We can tend to have more carbohydrate cravings, and that can lead to candida overgrowth in the gut. We all have candida, but in women with PCOS, it can overgrow and cause issues, like I said, in terms of the symptoms that I just talked about. And then food sensitivity. So one of the biggest things is figuring out if you have a food sensitivity. And the way that you do that is by elimination diet. So taking the food out for at least 3 to 4 weeks and then putting it back in and seeing how you feel. So oftentimes women who I'm supporting report that they feel much better after stopping things like dairy products, so milk, cheese, butter, and yogurt. And when they put it back in, they don't feel as good. Maybe they're getting some abdominal pain or bloating or changes in bowel movements. And so if you have any gut issues, the first thing is, I think, to consider dairy, consider gluten, do an elimination diet, maybe add some probiotics in. Another really nice one, supplement for gut health and healing the gut, is L-glutamine. This is an amino acid that can heal the lining of the gut. So we find that this can be really helpful for any type of gut health issues and when we're trying to restore and heal the gut. And then also even considering a stool test. A stool test can be really helpful to figuring out what the actual cause is. Sometimes with gut health, it can be hard to determine the actual cause, but if we use something like a comprehensive stool analysis, the one I like to use is called GI Map by Diagnostic Solutions. We can find out a lot of information. Is there any parasites in there? Are you sensitive to any foods? Is there H. pylori? How's the gut bacteria look like? Is there candida present? There's so much information can come out of a stool analysis. So I hope this was really helpful and gives you a little bit of idea of gut health and PCOS. I just want to remind you, tomorrow is our webinar. It's 3 powerful ways to rethink your PCOS. If you're struggling, if you're like, hey, I've tried so many things and nothing's really worked, I really urge you to come and rethink some of the things that I've been seeing online that a lot of people have been trying or suggesting. And I'm going to be talking about ways to really rethink this, and hopefully it can help move the needle for you as well. I'm going to be showcasing my online course. It's Your PCOS Planner tomorrow. So come out, learn a little bit about that. And again, happy PCOS Awareness Month, and hope I'll see you tomorrow. Bye.